everybody. So my name is Rachel Zimmer. I am a doctor of nursing practice and I'm on faculty at Wake Forest Baptist Hospital. I work in gerontology, and I also founded and direct a mobile health clinic that serves people who don't have health insurance in Forsyth County. And then I also started a food prescription program in March of 2020, and we provide fresh, locally grown produce and prepackaged meals to older adults who are food insecure in Forsyth County. So in my role as a primary care provider for older adults in their home and as a provider on the mobile clinic, I have found a couple of things that have been helpful in building trust around the COVID-19 vaccine. One of those things are having just honest conversations around what we know as a healthcare community about the vaccine, what we know are the risk of those vaccines versus the benefit of the vaccines, and also the risk of COVID-19 in general and how the vaccines can help mitigate that risk. So, the severe illness that can come along with getting COVID-19. Also, in addition, I've had the pleasure of being a part of the COVID vaccine task force, and we have partnered with community leaders and community partners in messaging as well. So we have local Hispanic, Latino pastors who have moderated sessions with other physicians and nurse practitioners and PAs who look like the communities that they serve and ask questions around the vaccine. And I believe that that's really helpful because then you're hearing from people that you look like about the vaccine and its effectiveness and its safety in communities. Also, the mobile clinic has been going into communities that are underserved and doing vaccination events. And we have found that, especially at one particular senior living center that we were at, that people would actually cancel the day of getting their vaccine, but then would reschedule themselves when they saw that other people in their community were getting vaccinated that day and were actually being, that it was safe and that they were okay. So there was a lot of fear alleviated in the community because their peers were getting the vaccine and they saw that they were okay as well. So I think there's a variety of strategies around how to build trust. I think it all stems from relationship, and I think that it requires healthcare providers and nurses to just sit down and be able to have those honest conversations with people about the vaccine one-on-one and in group settings. Yeah, so I think the most important thing to know about the vaccines, and now there are 3 on the market, right? So there's Pfizer, Moderna, and Johnson & Johnson. One of the most important things to know is that they are all highly effective at preventing serious disease. I know that there have been some questions around, well, this one's 90%, and this one's 95%, and this one's only 66% effective. But those are actually effectiveness rates looking at if there's 100 people, 95 of those people will probably not get COVID-19. So that's looking at, whether or not you're going to get COVID-19, but all of them are 100% effective at preventing severe disease. And so I think that's something to really keep in mind. And the risk of not getting the vaccine is greater than the risk of getting the vaccine. And so what that means is that you don't know how you're going to react to getting COVID-19. Some people get very, very ill and require hospitalization, and some people only have mild symptoms, but there's really no way to know until that happens. And so for everyone's safety, it's important to get vaccinated. And especially to protect our older adults who are most definitely at higher risk for becoming ill. I had several patients over the course of the last year who got COVID-19 and were homebound older adults, and they had asymptomatic people coming into their house carrying COVID, and it got them sick. So those older adults never left their home, but yet some of them actually died because someone who was asymptomatic and had COVID brought that into their home. So I think it's just really important that we consider our older adults who are at the highest risk for becoming ill and dying from this disease. And a vaccine is a very low risk way to help prevent further spread of this disease.